I'm Dr. Ruth Roberts, your pet's ally. Hope that everyone is having a great day and that life is not too insane as we run up to the holidays. Um, we've just got a couple of questions today, so let me pop over to my cheat sheet. Um, there was a question off of YouTube last week wondering about putting 6 cloves of garlic in the CrockPet diet by accident. And the quick answer is, is that going to harm her? And the quick answer is probably not. So, gosh, six of you on today. Great to see. With the deal with garlic is that a 50-pound dog can eat one whole clove of raw garlic every day. And the issue of garlic is that alyssium can create some problems as far as something called uh, Heinz body anemia, where some abnormal structures are formed within the red cells. When the garlic is cooked, it takes the alyssium level down tremendously. And this happens in humans, by the way, but really under very unusual circumstances, like, for instance, starvation. Uh, and that's really all there is to eat. So, no worry there. It gets cooked out. Everything should be good. Um, We've got a question from Bisan Masood, and she recently purchased the kidney support program who had stage 2 kidney disease and had started giving her arginine. And the idea is that arginine can actually reduce the amount of inflammation at the level of the kidney and improve kidney function. But on the most recent SDMA test, the value was greatly elevated from 24 up to 35 on this last test, about 6 weeks later. And so, could the arginine be affecting the SDMA results? And it is possible because SDMA is indeed measuring a metabolite of arginine. So it's possible that that is increasing the results. The other thing you would want to do, Bisan, is to make sure that there is no other things going on that would increase the SDMA. For instance, worsening kidney disease, something else creating inflammation within the body, because ultimately that's part of what SDMA measures is inflammation in general. And then the other thing is that in terms of the supplements that really work, quercetin really seems to do a much better job than arginine. Um, the so just kind of take that with a grain of salt. Make sure there's nothing else happening with the kidneys, but you may want to um, add in some quercetin um, to your regimen. And Janet, I will get to your question in just a moment. Got a couple of other ones here. Melinda was asking about her dog Willow, who's been fussy with the crock pet recipes. She'll eat ground meat with calcium and salt, and she'll eat blanched green beans and peas on the side. And so she's now finally getting sort of a regular dose of her vitamins if it's hidden in shortbread or gelato. She's a girl after my own heart, and she loves the probiotics, which is awesome to hear. Um, so their challenge is getting her to eat a reasonable amount of food every day. And if the if they feed the meat and the veggies separately, they'll eat them. And so, no, that would be okay. You can indeed separate them and just, kind of reconcile back to how much she ought to be eating in a day and make sure she's getting an adequate volume. So that's perfectly fine. Um, and there is no risk of not giving spices for a long period of time. They are meant to be a complement and sort of more of a long range strategy to help improve things. And the squid oil seems to create some mucousy stool. And at the dose you're giving at a quarter teaspoon, this should not be an issue. So I think it's just that the squid oil doesn't work very well. The pure fish oil we do not carry any longer. You can look at that. I'm not sure what's available in Canada, but frankly, what I would do is look for an algae-based omega-3 fatty acid supplement because if she's sensitive to the squid oil, that um, there's a chance that she may be sensitive to fish oil in general. And then lastly, Leona's been using CrockPet for over a year and her pups are well, but it's a lot of prep work. So she's wondering about Dr. Harvey as an alternative. And the issue with Dr. Harvey stuff is that the base is really pretty much the same for all of his recipes. The only thing that's really changing is the protein. And I've seen some dogs develop sensitivities. So, if you want to use this just intermittently to really help kind of take the burden off if you're having a tough week, then that's something you could use. Um, the the taurine you can certainly supply separately or just continue using holistic total body support, which does have a lot of taurine present. So, and thankfully, um, we do indeed we have found miraculously, the old distributors found 70 some odd jars of holistic total body support. So that is back in stock for a little bit. So if you're out, now is the chance to go get it. Um, let's see, Janet's asking, what can I do to help? These are two beautiful questions together. What can I do to help my dog who had an ALT liver enzyme of 877 after his rabies vaccine? It's normal now, but what else can I do to help him? So what I would do if you didn't use Thuja is to get some Thuja. And the reason is that it it will help to reduce any effect of the rabies vaccine, and will also help um, kind of calm the immune system back down as well. The other thing I would consider is using a round of liposomal glutathione, because that's sort of the master antioxidant of the liver. And Janet, I'm not sure how big your pup is, but there are some directions for dosing there. So I would think I would add that in. And then, Aaron, good to hear from you. Can you give Thuja to a puppy in the middle of all his puppy shots? Absolutely. So, if he's had several vaccinations, what I would do is use it for 21 days. If it's been more than a couple of weeks, normally what we would do, so same answer for you, Janet. We would do is give a drop per 10 pounds of body weight. Twice daily for 5 days after a vaccine. If it's been a while, then I would do it twice daily for a total of 21 days. And so, Aaron, if your pup is at sort of through most of the vaccines, you may just kind of continue to run it on. Um, oh, that's excellent, cool. So Mongo, who is a delight, I got to meet Aaron and Mongo a couple of years ago, had his rabies last week, and she used the Thuja, and no problems with a post vaccination lump forming, which is excellent because that was a problem last time. Let's see, and I think we've got yeah. This is a really cool story I want to share with you all. And by the way, we've got this up on our regular Facebook page so that those of you that are not CrockPet members can get an idea about what we do every week with broadcasts. So Lolly was kind enough to share this story with us about Bogart. So 6 years ago, which is as a long time feels like, she, she saw that Bogart's liver enzymes were popping up despite being on a good kibble. So she found the CrockPet diet when I was still owned Sundog Cat Moon Veterinary Clinic. We were giving it away at that point, but the reason I don't do that anymore is because there were so many problems with recipe creep that people were calling me and help asking me to help them fix the problems they created by not keeping the diet balanced. So that's part of why we do this, and then also we keep everything, um, as far as the weekly broadcast, so I can support you with that. And this is just, I mean, this is so awesome. So here's Bogey, 14-year-old Scotty, who had his teeth cleaned because his blood work was that of a 2-year-old, because everything is just chilling. And Lolly does read a lot, and she is a wealth of information about a myriad of subjects for dog health. But I love that his birthday cake is a chicken. So happy birthday, Mr. Bogart. I'm so happy you're doing well. So thanks for that, Lolly. It always makes my day to hear these great stories. Let's see, Leona, we got that covered for you. Um, it's Christmas and we have lots of sales going on. So again, we've got Holistic Total Body back in stock. And then the other big thing is that I want to welcome our new members. So Linda Hostetler, we had a consultation a week or so ago. Mimi Musselman, if you're from Louisville, Kentucky, I think I know you. Uh, who knows? Terry Wilson, Brenda Shorter, and Katie McCain, welcome. This is where we can help you with your food questions, and this is a lifelong membership. So I think that is what I've got for you this week. Let me double check my little cheat sheet and make sure I haven't missed anything. Um, but this is Yeah, that's what I've got. So many thanks to all of you for all of your support over this last year. I'm looking forward to 2022. We're going to start doing a couple of different things as far as the way we present the CrockPet diet. But I just the more I read, and as I am taking the natural animal nutrition course through the College of um, Integrative Veterinary Therapeutics, the more convinced I am that cooked food and veggies and things of that nature really are important. What we're finding is um, that raw diet, there's some papers showing that it actually alters the microflora, not for the better. There is evidence that dogs do possess genes to produce amylase. They don't have to have starches, as we don't have to have starches, but they can indeed digest starches just fine. The reason they don't have salivary amylase is because they gulp food. So it's sort of like, why bother? Um, but I am more and more convinced that this is the right way to go for pets and for the planet, because we reduce our impact on the planet by making plant products more of a part of their diet. The other exciting thing is through this course is I've learned how to use the animal diet formulator. They have some updated nutritional guidelines there, and I will be going through and reformulating all of the CrockPet recipes that are in the member site so that they are up to date. And the one change I can tell you for sure is that iodine, the amount that's required, has dramatically changed. And what was originally called for in by the veterinary nutritionist I had balanced the CrockPet diet, was a teaspoon of iodized salt. And it turns out that with the updated requirements, we're more at about a teaspoon and a half of kelp powder to get iodine up into adequate levels. Excuse me, a half a teaspoon per batch. Many of you make triple batches, so that's why I said this teaspoon and a half. And then something on the order of a little bit more than a quarter teaspoon of salt for the sodium and chloride. So that I can tell you, you should probably start adjusting now. Many of you are using kelp already because of the concern of all the anti-caking agents that's in iodized salt. So I would use kelp plus about a third of a teaspoon of sea salt or Redmond's real salt to make that up. Um, and that's what I've got for you this week. And Bisan, you're very, very welcome. Janet, you are so welcome as well. Have a very, very Merry Christmas. I will see you next week, next Tuesday, same bat time, same bat channel, and we'll go from there. So until then, remember your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.